Hi everyone. So just waiting on a few more to join us today. As I've mentioned, we will be looking at OET speaking and how to prepare for your 3 minutes of preparation for the live role play. And then after that, we will discuss various different strategies in order to start the conversation with your patient. So I'm just going to share the screen now. So I'm just going to wait a few more minutes. Okay, so while we're waiting, I'm just going to get myself started. Let's talk about some overview of OET speaking first. And then from there, we'll move on to the different strategies. Okay, so the speaking format and structure. So the speaking subtest takes about 20 minutes in total and consists of two separate 5-minute role play based on your typical workplace consultation. So this is the last part, or sometimes the first part of your OET exam. If the test center is quite busy, typically your speaking will be scheduled on the day after the exam. So typical exams are on a Saturday, so you might get your speaking on a Sunday if the test center is busy, or even perhaps maybe the day before, which is on a Friday. But the standard one is that the speaking role play happens in the afternoon after listening, reading, and writing. So you'll take a lunch break. You'll be told basically a week before or 2 weeks before, you'll get an email. You'll be told when the speaking test will be taken. So once you are in the exam room, basically you will be there for around 20 minutes. But not all of those 20 minutes will be tested. Um, the first part of your exam will simply be an ID check. Okay. So your identity and your profession will be checked. And then after this, there will be a short warm up conversation. And this part is not really assessed. Okay. So in this part, you will hear the interlocutor basically informing you about who they are, informing you about the type of the exam, and then you will be asked to confirm. And then around maybe 2 minutes, between 4 to 5 questions, majority of the times, you will be asked some questions. Personal to you. Why did you become a doctor? Why did you become a nurse? What do you enjoy about nursing or medicine or pharmacy or occupational therapy, etc. Okay, so let's watch a little bit of the ID check and the warm up question.
Okay, let's start. This is a recording for the Occupational English Test. The test is held in the CBLA office, Melbourne, 20th of February. The candidate name is Mary. The candidate number is 2019-58-1. The interviewer is Sally Smith, and the interlocutor number is 123456. The role play numbers are 1 and 2. The profession is nursing. Good afternoon. My name is Sally Smith. Can you state your full name, please?
My name is Mary Hafiz, and my number is 200019581.
Great. You're taking a test for nursing, is that correct?
That's right.
Great. Thank you. Can I see your identification document, please?
Here you go.
Okay, so please confirm your details are correct on the test paper, and then read and sign the candidate declaration on the front of your booklet.
Okay, once your identity has been checked, what will follow will be the short warm-up question or conversation, and as a reminder, this part will not be assessed.
Okay, thank you. I'm going to be working with you for this test. There will be warm-up questions followed by 2 role plays. Remember that this is a test of your English.
Okay, so
Okay, thank you. I'm going to be working with you for this test. There will be warm-up questions followed by 2 role plays. Remember that this is a test of your English, not your professional knowledge. Please speak naturally. Do you have any questions about this?
No, thanks.
Great. The warm-up questions are not assessed. It's a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. So I'd like you to tell me about your professional background. So why did you decide to become a nurse?
I just like to help. So I like helping people. So I feel like it's good for me to be a nurse, so I can help people and take care of their health. Yeah.
And what kind of a person makes a good nurse?
I think there is 2 main things: active listening and caring. Yeah, to be a good nurse, you have to have these kind of things.
And tell me about a usual day in your job.
I didn't work yet, but in my placement, when I see people laughing and they become healthier and more relaxed in the hospital environment, I feel like this is a good day for me. Yes.
Excellent. And what's the best thing about your work?
When you see people becoming healthier and more relaxed and more happier, and they getting better by time. So I think this is the best thing. Yeah.
Thank you. Let's move on to the role plays now.
So once the 2 minutes or around 2 minutes of warm-up is finished, your official assessment will begin. This includes 2 separate role plays. Okay. Now the role plays will be different from each other. And the first role play could be all about looking after a young child. Okay. And the second role play could be for an adult on an emergency situation. So do not expect that role play 1 and role play 2 will be exactly the same. You will take on the role of the nurse, the doctor, the pharmacist, or any healthcare professional, and your interlocutor will take the role of the patient or the patient's family member or the patient's carer. Now, The role play cards include details of your patient's condition and what you should cover in your role play task. This is what it looks like. The important thing is for us to be familiar with the different information given on your role play card. So right at the top, you see that you are working in a GP clinic. So if you're a nurse in a GP clinic. If you are a doctor, then you are a doctor or a physician or a GP in the GP clinic. The next important part is for you to look at the background area. The background area basically informs you who your patient is, what their medical condition is, and what is the reason for visiting you today. Now, those last two, they might not be exactly the same. They might be relevant to each other, but not exactly the same. So, say for example, your patient came to you because it's their regular checkup. Okay, so they thought, oh, this is just a regular checkup. I'm not expecting anything. I feel like I'm a healthy person. Okay, so basically, the medical condition could be diabetes, but the reason for visiting you is for a regular checkup. Now, for this example, we have a patient who had a blood test done a few days ago, or maybe a week ago or so. And then today, they're coming back to see you to find out their test result. Okay, so always remember that their medical condition might not be the direct reason why they are visiting you. The most important for you to find out is the reason for the visit. Okay, so for this example, is to get the test result, okay, from the blood test that was recently taken. Based on that, OET had provided you with several different tasks. Okay, that is the task of explaining, and then the task of finding out. That means to ask a question. And then you will see that your next task is all about explaining again. And the last one is emphasizing. Emphasize basically means that you're going to give an explanation, but you're going to use some grammar, okay, that signifies to the patient this is very, very important. Okay, so what's important to you when you are making preparation is to understand the differences between these three key areas. Okay, you've only got 3 minutes to prepare. So for each role play, that's role play 1 and role play 2, you will be given the role play card with a pen or pencil, and you will be given 3 minutes of preparation. Remember that you are able to make notes on the role play card. It's okay to write, to underline, to encircle during your preparation time, and you can ask any question as well. Your interlocutor will stop every role play after 5 minutes. So don't worry whether you think that you've been talking too much, because once the 5 minutes has been reached, this will stop. Okay, so your focus for the moment is the 3 minutes of preparation. So let's have a look at what it means.
Thank you. Let's move on to the role plays now. So I'll take the part of the patient or perhaps a relative. You'll take the professional role. So each role play will last 5 minutes, and the purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions? Thanks. Excellent. So you have up to 3 minutes to prepare the first role play. You will start the role play after that time. You'll know when 3 minutes are up. You can ask me if there's anything you're not sure about, and make notes on the role play card if you want. There's a pencil for making notes. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the first role play, and the role play number 1 for profession of nursing. Please start preparing now. Thank you. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play now?
Yeah. Hi.
Okay. So once your 3 minutes is finished, your actual 5 minutes of role play will begin. But let's have a look a little bit more, okay, on this 3 minutes of preparation. What should you do? Okay, this is quite important because if you go into your 5 minutes of role play without a proper preparation, several problems comes in. Number one, you will panic and you wouldn't know how to start. Okay, how to start a conversation is very, very important. It is like your initial introduction of yourself to the interlocutor. This is when they'll make an initial assumption in terms of your English ability. So the introduction is quite important. So during the 3 minutes of preparation, normally I would say prepare your introduction. You don't need to write everything as I've written in here. You can just write the very first start. You can say, "Good morning, Mrs. Brown. My name is Nurse Grace," or "My name is Dr. Grace. And I've been asked to speak to you today about your blood test result." Okay. If you're a fast reader and a fast writer, writing this introduction in complete sentences would be very beneficial to you. But if you're still thinking, "Oh, what should I do? How should I start it?" The best idea is just to write the initial introduction. And this is when you're thinking to yourself, should I introduce my name? Okay, is it required that I introduce my name, or is it just important that I, talk about my patient and make sure that I remember my patient's name? Between your name and the patient's name is more important. So always make sure that you greet them, "Good afternoon, good morning, good night." I doubt it will be good night, but those two, yeah. So if you're doing your speaking role play in the morning, then say good morning. If you're doing it in the afternoon, do say good afternoon, and then follow it up with your patient's name. Okay. Now, before I give you some more advice, let me just ask, okay, if you can type it on chat. How do you normally start your introduction? Do you do what you do in real life, wherein you are asking the patient's name, such as, "Good afternoon, good afternoon, Mrs. Smith. Can you please confirm your full name and your date of birth?" Is there anyone among you who does this? Okay, if you can type on chat. I just want to know how everyone starts the introduction. Do you ask the patient's full name and their date of birth? Or do you just simply say "good afternoon" and then the patient's name, and then you introduce your name? So you say, "Good afternoon, Mrs. Smith. My name is Dr. Grace. I will be your GP for today." Or do you just simply mention the patient's name and then carry on with the conversation? Okay, there's several different things that we can do or we can use in order to start the conversation. But what is most important is that you do not forget to use the patient's name. That's the key in here. Okay, so there are different areas wherein you would use that. Majority of the times, okay, we always say "good afternoon" and then the patient's name. Now, in terms of the patient's name, we always remember that your patient could be younger than 16 or over 16. The age of 16 is our magical number, okay? Your patient, if they are below 16 years old, will not be the patient that you are talking to during your role play. Okay, so if they are, always remember this, if they are younger than 16, you will be talking to their parent or perhaps a carer. Okay, if your patient is 16 years old and over, majority of the times you will be speaking to them directly. So always make sure that you understand who you are talking to, because if your patient is below 16, you might need to prepare two names: the name of the parent or the carer, and the name of the young patient. Okay, always remember that, because that's the part wherein you might sometimes panic and you're like thinking, oh no, I forgot to ask my patient's name. Okay, so if there is ever a time wherein you forgot the patient's name, what you can do is prepare a name. Normally, a good one is the one of someone that you know it's unlikely for you to forget, such as the name of your husband or your wife, or the name of your children or your best friend, etc. There will always be an instance wherein suddenly you're talking and then it's like, oh, I forgot to ask their name. It's absolutely fine. Do not worry about it. Okay. The key in here is to use a name, any name. Your interlocutor will answer to any name that you give them. It doesn't have to be their actual name. So that's key number one. Now, once you've done your introduction, the next key thing is to basically go through your tasks and understand what each of the verbs is asking you to do. Okay, when the verb is explained, it means you're going to give information, and typically when you give information, OET will give you examples inside the parentheses. Okay, so you'll be given examples in there, so don't worry too much about it. Your job is to simply add into the examples given to you, or to give more details about it. Now, there are three key verbs that OET uses when they want you to ask a question. The first one is the verb find out, which is what we have on bullet point number 2. The second one is the verb ask. And the third one is the verb explore. Okay, those three, find out, ask, and explore, they mean exactly the same thing, which is to ask your patient a question. So in here, we're going to find out what the patient knows about how to increase iron in their diet. So typically, you'll say, may I ask, what do you know about increasing iron in your diet? Okay, so it just simply means that go and ask your patient a question. You will notice on the third one, we've got another explain in there. So again, giving information. And when you see an explain, you will normally see examples given to you. In emphasize, that will be exactly the same. There will be examples in here. The difference with emphasize and explain, as I've mentioned earlier, is the use of some grammar that signifies to the patient this is very, very important. Such as on the last one, you can say, I want to emphasize the impact of your chosen diet, or I want to explain to you how important your diet is to your health. So something that says this is very important. So grammar is the difference between an explain and an emphasize. So your job within your 3 minutes, as I've mentioned earlier, is make sure that you prepare your introduction. Make sure that for the verbs, you have prepared the synonym or the paraphrase that you would like to use. So in here, you're going to use the same word explain, but you're going to put it in a sentence or a question. Okay, I would like to explain. In here, I'm going to use synonyms, okay, and antonyms as well, because basically we've got a negative in here. Not a long-term solution means it is short-term or short period only. Okay, so OET likes it when you use your own words and you're not using the role play card as if it is a script that you're using word for word. Okay. Hi there, Annette. Okay, nice to see you in here. So yeah, so it's always remember that OET expects that you would use your own words in here, or you would use paraphrasing. So for the EG in here, we've got 2 of them. You can see that I plan to use the words, the phrase such as, and the word like on the second one. You might say, how come I can't use both of them? Okay, you don't say such as in here and such as in here again. That's called duplication. Okay, When you duplicate words, you keep using it, it signifies that your vocabulary knowledge is quite minimal. Okay? So show OET that you have a good range of vocabulary, that you've got good grammar by simply knowing and using your synonyms. Okay, so that's the important thing. The other important thing that you can do during your 3 minutes is to remember that you are allowed to ask the interlocutor questions. Okay, questions that can help you during your 5 minutes of role play. Now, what you will notice is that I have highlighted the word inhibit. Okay, this is a slightly advanced vocabulary. So there will be some students who doesn't know the meaning of inhibit. So if this is you and you do not know the meaning, don't worry too much about it. This is one of the things you are allowed to ask the interlocutor. So you can say, excuse me, Miss Smith, can you please tell me what is the meaning of inhibit? Okay, your interlocutor is allowed to give you the meaning or the definition of the word. The other one that you can use is pronunciation, or you can ask during your 3 minutes. Okay, so say for example, in this instance, I highlighted the word iron. If this is a word you're not very familiar, in terms of the correct pronunciation, you can ask. Say, for example, you already know what iron means, but you just don't know how to pronounce it properly. So again, you can say, excuse me, Miss Smith, can I ask, am I pronouncing this word correctly? Is it pronounced iron? And they'll say, oh, yes, you are pronouncing it right. Or if you say, is this pronounced iron? And they'll say, no, that is not the correct pronunciation. This is how you pronounce it. And then your interlocutor will pronounce the word naturally first. And there's also a tendency they will pronounce it slowly so that you know and can copy the pronunciation. So those two are the key things that you can ask the interlocutor. The third one is that yes, you know the meaning, yes, you know how to pronounce the word, but you're still not very sure what OET wants you to do. Okay? So if you just simply want clarification, you can ask it as well. So you can say, Mrs. Smith, did I understand it correctly on the second bullet point? Am I expected to ask the patient if they know anything about iron? And then the interlocutor will confirm or deny or reject your question. Okay, so they might say, yes, that is correct. Basically, you're just going to ask the patient if they know anything about iron, and then you move on to the conversation. Okay, so this is something that is quite important, and I don't know whether majority of the students do this. I would do quite a few role plays with my students, and typically when I say you've now got 3 minutes to prepare, I'm waiting for them to ask me a question. In majority, I would say probably 80% of the time, none of them ask me the meaning, none of them ask me the pronunciation, none of them ask me clarification. And then by the time we go into the role play, I can hear the errors. Okay, the reason why you're making those errors is because you were not asking the questions right at the start. That's why I said, and we've set up these this speaking strategy, is because it is quite important for you to know you are allowed to ask these questions. Okay, the 3 minutes is your key to ensuring that when your actual role play begins, you have the right knowledge and the right information to use. Okay, any questions so far? Okay, if you've got any question, put it on chat, please. Okay, I'll have a look. Now, let's go into the criteria. What criteria will OET use to give you your score? You will be tested on intelligibility, fluency, appropriateness of language, and resources of grammar. These four is very simply, did the assessor, the person in Melbourne, in Australia, who's going to give you your score, did they understand you? Okay, was it easy to understand your recording? Is every question that you ask quite clear? Okay, when you are explaining, did they understand your explanation? If the answer is yes, they understood you, okay? And then when they listen to your questions to the patient, they say, the patient understood all of their questions. If the answer again is yes, the patient understood you, the assessor also understood you, it's quite clear, then that is the part wherein it's nice and easy to give you a pass score, okay, in terms of the linguistic criteria. So always remember that linguistic is simply, did I understand you and did you understand me? Okay, so majority of the times fluency is the key area in here. Okay, if you're speaking in a smooth, natural voice and you're not stopping a lot, then that means that's a good sign. Okay, don't worry too much about the last one, which is the resources of grammar and expression. You are allowed to make mistakes. Don't think that you have to be perfect. We don't have to be perfectionists, okay, when we are speaking, because even locals, the ones born in English speaking countries, they do make mistakes in grammar and expression or vocabulary. Okay, so don't think that you need to be absolutely perfect. It's okay. Now, the next criteria you will be tested on is clinical communications criteria. This is something that should come naturally to you if you are currently working in a healthcare profession. Okay, part of your job is to ensure that you are building a relationship with your patient. Okay, do you know their name? Are you using their name? Do you know their medical condition? Or even if you don't really know their medical condition before you came to see them, did you read about them? Okay, making your patient feel that my doctor, my nurse, my pharmacist knows me. Okay, that's the first one. The second one is basically, I would say, quite common and quite common error with OET test takers is, you're not giving evidence to OET that you understood and you incorporated the patient's perspective. What it means is that if your patient is asking you a question, did you answer it? Or did you ignore them? Okay? If they say, I don't really know why I'm taking metformin. Okay? So they said, I don't really know why I'm taking metformin. And you just say, mm-hmm. So the doctor will be seeing you in 1 hour. Are you okay to wait? So you just carried on talking. You ignore the fact that your patient says, I don't know why I'm taking metformin. Okay, this is where that part comes in. So always remember, if your patient asks you a question, don't forget to answer them. If your patient stated there's something that is concerning them or making them anxious, make sure that you offer empathy, that you offer an explanation. Say, for example, they say, I'm scared of needles. Did you say, oh, why are you scared of needles? If they say, I don't really like taking iron tablets, and you would then say, can you please tell me why you don't like them? Okay, this is when you're giving evidence to OET that you are listening to your patient. Now, the third one is actually a strategy that we're going to talk about a little bit later. Okay, this is the strategy of providing structure. Providing structure basically means that you're letting the patient know what things you will do during the consultation, which one will be the first, which one will be the next, which one will be the last. Okay, that you're also agreeing with them what the entire conversation will be all about, what your goals are, or what your patient's goals are, etc. And it should come from you as a healthcare professional. Okay, now the last two is all about just simply asking the patient questions and then answering patient's questions as well, so giving explanation. Okay, is there any question in terms of speaking format and structure? If you got any question, if you can put them on chat. Okay, so if you do not have any question, let's focus on starting the role plays effectively. Now, When you're looking at your role plays, it's very important, as I've mentioned earlier, that you look at the background of your patient. Okay, the very first thing that you need to look out for is their age. I don't know whether many of you are doing this. The age simply tells you how you are going to speak, or how you're going to use your patient's name. Okay, majority of the times OET expects that you will speak in in a respectful, formal manner. And respect and formal greeting basically means you are using the title and the last name of your patient. So you will say Miss Brown, Mrs. Brown, or Mr. Brown. Okay, so we don't use the full. You don't say Mrs. Sally Brown, Miss Sally Brown, or Mr. Robert Brown. Okay, we only use title and last name. We also don't use title and first name. Majority of you, this is a common error. Okay, I think it's culture, because in some countries, typically you use the title and the first name. You'll say, "Hello, Miss Grace, how are you doing today?" Okay, but in OET and overseas, when you're working in the UK, in the US, Australia, New Zealand, etc., the formal style is title and last name. So avoid using title and first. Okay, always remember, go for formal greeting, especially if your patient is an adult. So for this example, we've got a 40-year-old, we go formal greeting. Okay, now if your patient's slightly young, let's say for example 16, 17, 18, 19, 20, it's very hard to call them formally as Miss Brown, Mr. Brown, because young people tend to want to be called by their first name. So that's the time you can say, "Good afternoon, Sally. How can I help you today? What's the reason for your visit?" Okay. So speaking informally, or using the first name of your patient, absolutely fine based on their age. Okay. If they're a young adult, first names are fine. Okay. But no title, just first names. "Hello, Robert. Hello, Sally. Good afternoon. How are you doing today?" Okay, but majority of the times, if you are panicking and, "Oh, I don't know what name I should use," just remember OET likes formal greeting. So title and last name. Again, you can ask the patient if you want to, "Can you please confirm your name?" That's absolutely fine. Just don't take too long about it. Okay, or if you just want to carry on with the task already, give your patient a name. Again, as I've mentioned, if you remember the actual name of your interlocutor when they greeted you earlier, great. If you don't, you can use any name that you want. It doesn't have to be their name. Your interlocutor is trained to speak to you and accept the name that you give them. So don't worry too much about it. The next thing that you need to look out for, not just the age, is, again, as I've mentioned earlier, the reason for the visit. Okay, because the reason for the visit might not be their medical condition. If you look at this example, our patient has rheumatoid arthritis for the last 5 years. Okay, now that is not the reason why they're coming to see you. The reason why they're coming to see you is because the doctor asked you to speak to them, to meet with them in order to evaluate their current situation and for you to make recommendations. So you need to now understand what is the problem of the patient right now, not their medical condition, which they've had for the last 5 years, but their current issue. The current issue is that they're taking a medication for rheumatoid arthritis and they've experienced a side effect. That is skin rash. Okay? So you got skin rash in there, which is a side effect of the medication that they are taking. So basically, they're coming to see you because they're worried about the rash. So the doctor asks you to see the patient, and it mentioned in here that you have already examined the patient. And when you examine the patient, the rash is mild and it is inflamed. Okay, so yes, the rash is still there, but it's mild only. but their joints are inflamed. You are now asked to basically explain to the patient that mild rash is not uncommon. It means it's common. This is what we call double negative, okay? You've got the negative not and the negative un. When you have double negative, that simply means that this is, remove that one, it becomes the mild rash is common, okay? So remove both negatives and you will be left with the actual information. So you're going to explain that the rash that they're experiencing, pretty common. It's something that everybody experiences when they're taking the same medication. So you're going to explain that, and then you're also expected to stress to the patient. Stress means tell the patient how important it is that they continue the medication. So the recommendation is continue, because normally if a patient is experiencing side effects, they might ask you to change, okay, the medication because they don't want to experience it. But because it's mild, you're not very worried, then your recommendation is to continue. Okay, so let's listen to a recording about this. Here we go.
Exercise 1. Nurse A.
So, Mr. Jones, I can see that you still have the mild skin rash that was there when you came in to see the doctor, and I also noticed that your joints are a bit inflamed. But let me start by reassuring you about the rash. This sort of rash is really quite common with the medicine you're taking, and it's nothing to worry about. You should keep on taking the medicine.
Okay, so what you will notice is that we use the formal name, Mr. Jones. What you will also notice is that I or the speaker never introduced their name. Why? Okay, because the scenario of this role play card looks like you know the patient already. Okay, so if you know the patient, there's no need for you to mention your name, but it's always very important you mention the patient's name. So we are using Mr. Jones in here. And then what you will notice from the introduction as well is that they've mentioned the reason why you are talking to the patient, okay? That they have a mild skin rash that was, that was there when they came to see the doctor, and that you've also noticed that their joints are inflamed, okay? And then what you did next is you went to do the task. Remember, you have two tasks. Number one is to explain, and number two is to stress. So you did the first one first. This sort of rash is really quite common, okay? Because remember, double negatives, okay? It's really quite common with the medicine you're taking, and it's nothing to worry about. And then you did the second task, which is you should keep on taking the medication. You're going to recommend to continue. Okay. The other thing that you might notice in here, which I've written in orange, okay, is the phrase "let me start." This is what we call signposting. Okay. Signposting basically tells the patient what you are going to do, or it lets them expect what they, what will happen during the consultation. So let me start basically means this is the very first thing that you will do, which is first task. So this is a quite common phrase that we use for task number one. We use let me start, okay? We can also say let me begin. First is also a common one, okay? So you can say first, I want to reassure you about the rash, or let me begin by reassuring you about the rash. Let me start by reassuring you about the rash. Now, when you are now talking about stress, okay, so because this is now the second, you can also use signposting if you want to, okay? In here, they just went straight. But what you can do in here is in here, let me start, okay? And then in here, you can use the word and then, okay? You can use, and then please continue with your medication. Then and then means after the first one, okay, or after the one mentioned before. So and then is always used for number 2, number 3, number 4, etc., but never for number 1. Okay, so for number 1 or task 1, we can do let me start, let me begin, or first. That's a good idea. But this is something that would be quite helpful or beneficial for you when you are doing your speaking, because this is part of your criteria earlier, wherein you need to provide structure. Providing structure basically means you are guiding the patient as to what's going to happen during the consultation. So in here, you are guiding them. Let me start. This is the first thing that I am going to do. So you will also expect that if you manage to use the very last task, okay, then it will be expected that you will use signposting again. For that one, we can then use the words finally, okay, or you can say as a last question, okay, or you can say before you leave the clinic, because you are at the doctor's clinic. So you can say, before you leave the clinic, let me please remind you that you need to come back and see the doctor in 2 weeks' time. Okay, so you need grammar, a phrase that tells the listener, your patient, that this is the very last thing you're going to ask or you're going to explain. It also signifies to the assessor of OET, the one who's going to give you the point, that you are telling them this is the last task. Okay, so it's always very important that we do signposting. Another good one to do is when you are signposting is you signpost within your explanation itself, just like this one. Okay, so because we've got 2 things that we're going to do, it's a good idea to signpost in here. As I've mentioned, we can use then. Okay, so those are things that we can do. Other ideas in terms of greeting is basically if you've got any role play wherein it is starting in the middle already. What do I mean by in the middle? Okay, sometimes you'll get a role play, a background information like this, but it will tell you you've spoken to the patient already, you've greeted them already, you are now in the middle of the consultation, such as it might say that you are speaking to the mother of a 2-year-old. Okay, and then it said that you took the vital signs of the child and the vital signs are all normal. You are now going to explain to the parent that the child is ready for discharge. Okay, so that meant that there is no need for you to do an introduction. Why? Because you are already in the middle of the conversation. You've already seen the parent earlier. You've already seen your patient. You've already taken their vital signs. So if your role play task shows that you are already in the middle, we don't do good afternoon, Mrs. Smith, good afternoon, Mr. Brown, my name is Nurse Grace, or my name is Dr. Fahad, I will be your GP for today. Those are not necessary. How do you then introduce the role play? Okay, so in such cases wherein you've already met the patient and the patient's parent, and you've already taken the child's vital signs, it says it is normal. Okay, and then it says that the patient is ready for discharge, then you can actually start with what you've already done according to the role play card. Okay, so you can see, Mrs. Smith, I've already taken the vital signs of Robert, and I'm happy to inform that everything looks normal. Okay, I would like to tell you that we're going to monitor him for for 5 more minutes, and if everything is still the same, then he is free to go. Okay, so as you can see, I never said good afternoon, but again, as I've mentioned at the start of our webinar today, what you should never forget is to use the patient's name. So even though I am starting in the middle, you might have noticed I still said, "So, Mrs. Smith, I have taken the vital signs of Robert." Okay, Robert being the child. And everything is normal, and he will be ready for discharge. Okay, so that's the only scenario wherein you don't need to do good afternoon. But if your task is always find out the reason for the visit, okay, ask the patient what they know about asthma, then that means you are at the start of the consultation. You're not in the middle. And if you are at the start of the consultation, it's always a good idea to do your good afternoon, good morning, greeting. And that's the reason why if you're seeing our sample today, there is no good afternoon in there. Okay, it just went straight into the patient's name. Why? They are starting in the middle. Okay, how do you know you're starting in the middle? It says you have already examined the patient. You've already seen that they have a mild rash. You've already seen that they have an inflamed joints. And precisely what you said in here, I can see that you still have the mild rash, and I also notice that your joints are a bit inflamed. This is a role play card that started in the middle. Okay, so let's have a look at another one before we go. So this time around, you are working in a community health center. Again, we focus on the age of the patient. So this is 35-year-old patient, adult. We're gonna go formal greeting, Mr., Miss, Mrs. The medical condition is anemia. Okay, now again, medical condition and the reason for the visit might not be the same. So let's have a look. Why is this patient seeing us today? You will notice that the patient has been referred to us by the family doctor. What does the doctor want us to do? They want us to give further advice regarding the condition of the patient. What is the condition? Anemia. Okay? And then the doctor also wants us to give necessary dietary adjustment. Okay, so formal greeting, Mr., Miss, Mrs. Okay, medical condition anemia, reason for the visit, a referral from the family doctor. Now, when your role play card is a referral, always remember that in OET, that signifies this is the first time you are seeing this patient. You've never met them before. So if you've never met them before, it's very important that you greet them, use their name, and also do not forget to introduce your name because you don't know them. Always remember the magic word in here is refer. Whenever you see the word refer, not just on speaking, but also in writing, it means you are meeting the patient for the very first time. Okay? So your job is two things. Give advice regarding anemia, and number two, make dietary adjustment. Now, let's have a look at your task. It says, go and ask the patient a question. How do I know? Because the verb is find out. And always remember, find out, ask, and explore. All these three verbs means ask the patient a question. What question will you ask? Whether they know anything about, whether they have any questions about their diagnosis. What is the diagnosis? Anemia. Okay, so if you're ready, I'll play the recording.
Nurse B.
Good morning, Mrs. Trelaw. My name is Oriana Hellman, and I'm the nurse who'll be dealing with you today. So, you've been diagnosed with anemia, and you've been referred to us to help you deal with your condition. Is that right? Before I get to that, can I start by asking you if you've got any questions about your diagnosis or about anemia itself?
So again, as I've mentioned, you are starting at the start. Okay, this is not the middle of the role play. So you are expected to now do good morning or good afternoon. Because the patient is an adult, we are expected to use formal greeting. We use Mrs. Trelaw. And because this is a referral, you're seeing the patient for the very first time, you are expected to introduce yourself. My name is Ariana Hellman, and I am the nurse who will be dealing with you today. Okay? The next thing within your introduction is to mention the medical condition and the reason for the visit. So, you've been diagnosed with anemia and have been referred to us to help deal with your condition. Is that right? Okay, so you're getting confirmation from your patient. And what you will notice is that on task number 1, she used signposting. Before I get to that, can I start? Remember, can I start? Let me begin. Let me start. Or using the word first is always a good signpost for task number 1. So the speaker says, can I start by asking you if you have any questions about your diagnosis or about anemia Excel? Okay, so hopefully that's something that will give you extra strategy, extra knowledge when you are preparing for 3 minutes and when you are ready to make your first introduction. As you can see from the role play cards that we've shown you, we never actually shown the full task because in introduction, the important thing is the background information of your patient and then task number 1. Always remember that OET likes it when you use signposting. Can I start? Let me begin first. This is the last task. You can say finally as a final question or before you leave the clinic. Those are good ones. If you're discharging the patient, you can say before you are discharged, let me remind you, etc. Right in the middle, you can use grammar that says additionally, also, then, and also, may also. All of those grammar signifies you are in the middle of the task. Okay, so thank you very much everybody for attending today's speaking class. I just wanted to do this because I don't know if you know, but we are doing another speaking class this time around, via OET's YouTube channel. And our topic for next week is speaking, but with the strategy of signposting. I gave some signposting strategies already today. Let me start, let me begin, finally, before you leave the clinic, etc. But I will be talking more about them in more details with more examples next week. Okay, so thank you very much everybody. It's been a pleasure speaking to you today. And for those that any of your friends or family members who you think may benefit from this class, remember that this is going to be recorded on YouTube and will be available on YouTube on our channel. If you don't want to miss any of our future recordings and live sessions, please do not forget to follow us. Okay, thanks very much everyone. Bye for now.